Hello, good morning friends. I am Dr. Kanu Verma, consulting dermatologist practicing in Dwarka. Today I am going to speak about fungal infections, fungal nail infections rather. These infections are very common infections. Normally they can affect any part of the body. They are not very serious infection, but they are unpleasant. When they infect the nail, then we call them fungal nail infections. In our language, or say medical term for the fungal nail infection is Onicomicosis or Tinea Unguium. Usually this fungus, some amount of fungus is a normal commensal of the skin along with the other bacteria. But when this fungus overgrows, then develops the infection. Now the nail fungus, particularly which is our topic of the day, it is a very slow growing infection, usually often goes unnoticed, and patient becomes aware when only the nail plate get damaged or there is some pain in the nail. So why this fungus grows up? Fungus actually requires the warm and moist environment to develop or to grow. When some unnoticed injury happens to the nail fold or nail plate, then it creates a nidus, and along with a warm moist environment it starts developing, as it is a favorable environment to grow. And it usually the injury is so trivial or small that it often goes unnoticed, and the patient is not at all aware that he got the infection. When only the nail plate got discolored, some lines, crumbled nails, any type of signs or symptom present in the nail, then the patient comes to a doctor, what happened to my nail, just please check. So this is how the patient become aware of the nail fungus. Who develops the nail fungus? Those who are working in the warm moist environment for long hours develop the nail fungus, like the household wives, even the working women also, those who work with the those who do the household work with the dirty waters or washing utensils, cleaning and washing work, or doing gardening, they don't know when they got the injury or cut in the nail, and this create a nidus for the fungus to grow. Or persons who are having the pre-existing some diseases, like some type of immunocompromised state in their body, like diabetes, any local psoriasis like condition, elderly male female both, or the persons who are swimmers or walk barefoot in the swimming pool, locker room, gym khana, this type of population usually get the fungal infection more commonly. However, toenail infection is more common than the fingernail infection. How do we how do you diagnose the fungus that your nail is infected with the fungus? The only thing is which you can see the discoloration of the nail plate or some swelling or pain in it. For that you have to visit a dermatologist for sure. Either he will take some scraping of the nail for the diagnosis of the fungal. Infected nail usually looks like greenish yellowish discoloration, some discharge, swollen nail folds, some crumbled, if it is advanced, then crumbled nail plate, distorted nail plates, furrows in the nail, or sometimes the nail plate get lifted up because of some deposit due to the fungus growth, scaly deposits. These are the common features, and sometimes nail is totally destroyed if patient avoids the fungus, and it just taken for granted ki okay, it's a simple infection, let's leave it. Then the nail plate got completely damaged and it becomes irreparable. Then we have to go for the complete nail destruction only. There will be complete nail destruction, and nail treatment will be very difficult. Now, how the fungus can be treated? It is not like it is not treated, it is treated, but the treatment is very slow. It depends the amount of damage to the nail plate. Both type of treatments are available. Oral tablets are also available, and topical creams. That depend, the dose and duration of the treatment depends upon the amount of damage, number of nails involved, and also the patient tolerability. As the treatment of the nail fungus is not for the 15-20 days treatment, it usually takes months. On an average for fingernails it takes 3 to 4 months, and for toenails it's 4 to 5 months. Nowadays laser treatment are also available for the nail fungus, which are fast, effective, and for those type population of patient who can't tolerate the oral antifungal tablets. Now, how to prevent the nail fungus? It is mainly that how much you take care of your nails. More you take regular checkups for the nail injury, regular clipping of the nails. If don't share your nail clippers with anybody else, go to the saloons where manicure and pedicure is done with the sterile equipments. If you are a diabetic, then proper control of the sugar should be there. And don't walk barefoot in the locker rooms. Don't keep your nails and foot moist for long hours. If you have to wear shoes for long hours, then use some antifungal powders so that the area remains dry, fingers remains dry, and fungus does not get the environment to grow. This is all, friends, for the just a small tip how to prevent and what is in short about the nail fungus. Thanks a lot.